Today, we're talking about advice for new surgical interns. I'm going to give you 10 things that I think would be really helpful to know if I was starting my surgical internship again. Let's do it. Welcome back to Citizen Surgeon. My name's Dr. Eric Pearson. I'm a pediatric surgeon, and today we're talking about advice for surgical interns. A little bit different. We're not doing an educational topic, but this is educational, right? I mean, it's important if you're going to go into something new. You just graduated medical school, you're going to be starting your residency. I could look back and think, what are some things that would have helped me? And so let's go through 10 of those things. And this isn't just limited to surgical interns. If you are a medicine intern, a peds intern, whatever, perhaps this could help you too. So I hope this is useful, good value for all audiences. Let's get right into it. Number one. Now, these are not numbered in any particular order, but I would say number one could be the most important thing. And some people might put this at number 10, but I put it at number one. And what is that? Well, that is taking care of your physical, mental, and emotional health. Well, why is that number one? Well, let me tell you that surgical internship, any internship, it's a long year. It is hard. The hours seem like they're endless. There is an unlimited amount of information it seems that you need to know. And most people are pretty uncomfortable making these big decisions. Okay, so all that is a heavy weight, and that can make your physical, your mental, your emotional health pretty rotten. Okay, so how do you do that? Well, first is to have a process. Okay, now you might not have a lot of time, you might not have a lot of energy to go to the gym, all right? But think about how can you get 30 minutes of exercise in every day? Can you get the Peloton app and go through one of their core exercises every day? Can you figure out a short run around or a walk around where you live that's safe? Okay, for your emotional, for your mental health, using like a meditation app, finding somebody you can confide in, talk to about the stresses that you're going to go through as an intern. That person could be in the program or out of the program. Maybe you're reconnecting with a friend from college or somebody that's really close to you. It could be your spouse, it could be your parent. So think about that as one of the most important things when you're going into internship is to set up a process for your physical health. Also know that you might not be eating that well, so that's part of your physical health too. So, maybe taking something like AG1, just a daily multivitamin drink that's going to, give you some baseline vitamins when you're eating, graham crackers and leftover patient trays. Not that happens, but it probably has happened before. So what I'm trying to say is to have a process, because if we don't take care of this in the first year, it's going to get more difficult when our physical, mental, and emotional health gets out of whack in the years to come. All right, so think about that and how that would apply to you. All right, so let's get clinical. Number two, getting clinical is when you're on call, you're representing your surgical service, you're taking care of patients. Clinically, you got to know where your help is, how you can reach that help, and actually do it, actually call for help. All right. The other part of this is don't be a hero unless you have to be. Okay. So know the numbers of your seniors who are in-house. Know the numbers of the senior residents that are on trauma call in-house. Know the numbers of the ICU intensivists that could help you out if you get into a tough situation. Know the number of the attending on call that you could call if other people are unreachable. You don't want to find yourself in a situation where you're in trouble, the patient's in trouble, and you don't know who to call or how to call them. All right. So knowing who your help is, what that lifeline is, often in surgery, we'll say load the boat. Load the boat means, if the boat is sinking, which means you have a really sick patient, maybe they have an unstable airway, or maybe they're in septic shock, or hypovolemic shock in the trauma bay. You need to rescue that patient, but you are on a team. And as long as you know how to access all the important members of that team, you'll be able to rescue that patient. Now, sometimes, and I think this is very infrequent for an intern, but it happens where you have to be the hero. Maybe you have what happened to me on my first night of internship. You have somebody that has an opioid overdose and you're ordering and delivering Narcan, okay? Something like that. Maybe an airway or something is happening or a code and you need to start to act. But know your lifelines, how to contact them, and actually do it. Reach out early and reach out often. All right, number 3, still clinical, really critically important, is to document everything. You're doing patient care, and documenting all of the decisions you make helps not only with communication, it lets the other providers know, the other teams know, the other doctors know what has been going on with that patient. And it also protects you in adverse events. For instance, let's say somebody comes into the hospital and has a threatened limb, okay? And all night, you're up there every 2 hours doing a pulse exam, making sure that we don't have any pulselessness or paresthesias or paralysis or pallor, the 6 Ps. And let's say you do that, but you don't document it. And at 6 a.m., the leg is blue. And in reality, maybe that happened just in the last 30 minutes. And your senior resident said, well, haven't you been doing this all night? And you say, yeah, I was here. Well, where's the evidence? You got to document everything. When we're doing serial abdominal exams for trauma, you got to document that abdominal exam. Was it soft, non-tender, non-distended, or do we have peritonitis? Did you review the H&Hs? Do we have a falling hematocrit? Did you document that? Sometimes it just takes one line, but make sure you document everything. Number 4 is one of the most important ones. I wish I could put all these as number 1s, but I gotta, have some sort of list. They can't all be number 1. So this is number 4, and that is be honest. Now that might seem obvious. Of course, you're going to be honest. But when you have 30 patients and you're in the morning putting everything together, there's a chance you could miss a BMP, a basic metabolic profile. You might miss going through a set of vital signs. And when somebody asks you, was that normal? Or what were the findings? Don't lie. If you don't know, you don't know. Don't make it up. And saying, I don't know, while it feels really uncomfortable, you got to do it. You got to say, I don't know. Let's review it. All right. So really important, whatever you do, you got to be honest. That goes along with documenting everything. Be honest, have integrity, say you don't know if you don't know, but being honest, that is part of the profession. That's what our profession is based on, is honesty and integrity. Number 5. Now, you might think that being an intern means that you need to be out on the floor, doing work, checking the boxes, getting everything done. And there is a lot of truth in that. Okay, you learn a ton of useful information by checking those boxes, doing those serial exams, doing those post-op checks, writing those HMPs, even doing the discharge summaries. We used to joke that SCUT work, SCUT stood for some clinically useful training, all right? Now, it's just work that has to be done. But what I would challenge you to do is get that work done and get in the operating room. Get the work done and get in the operating room, all right? So don't just sit on the computer all day and just, this is where I'm supposed to be, writing the notes. Get it done so you can get in the operating room, even if you're the second scrub or the third scrub or just watching, even if you're just sewing skin at the end, okay? You should be doing everything you can do to get in the operating room and seeing as many cases as possible, okay? Because the real learning happens by being around in infrequent events, okay? So an adverse event happens, something unexpected happens, and you're around. You're going to learn because you're around, and that learning is going to stick with you in the years, decades to come. Get your work done, get in the operating room. That is number 5. Number 6, this can be a tough one, all right? And again, maybe it seems obvious, but you have to have a process to read and study and read every day. Now, I can tell you what I did, and I can tell you what I recommend, and I recommend just taking a major textbook for surgery. Take Savistens, okay? I think Savistens is the reference text for surgery. Every intern needs to read that book and finish it cover to cover by the time you finish your intern year, or at least by the time you finish your second year, okay? That's what I recommend. And how do you do that? You just read a little bit every day. Remember, surgical residency, this is 5 years long, at least. For me, it was 7 years because I did 2 years of research. So there is a lot to learn in 5 years. And if you just take 30 minutes every day. So what I did is I had my textbook open on a desk just like this, okay? I had the coffee pot come on at 4 a.m. I would walk right into my desk. I'd grab my cup of coffee. The book was already open to the page I left off at, and I would just read, all right? 30 minutes every day, 4 to 4:30, and then it was time to get ready and get to the hospital. Okay, so if you just have a process, the same goes for learning from cases. How are you going to take away from cases? I have a video on using Evernote, and I think Evernote is a great way to learn from cases. You can make a notebook and for every chapter in the surgical textbook, and every time you do one of those cases, you put in the notebook, what was the incision? What were the ports like? What suture did we use? What made that case easy? What made that case difficult? What was the specific retractor we used? All of those little things. You're going to develop your own way someday. But until you do, it's nice to go through and be like, yeah, I really liked that. Or no, I didn't like how they did that at all. So have a process on how you're able to read every day, all right? And have a process on how you're going to take the information from cases. So you may have to supplement that daily reading if you're on a specialty rotation. Let's say you're on colorectal surgery or transplant or the ICU. You might have to do some extra reading, but I implore you to read at least that cover to cover every day to make the progress so you can get through a whole textbook and have a really solid foundation in surgery. Number 7, I think one of the most important things that you can do as a new intern is to strive for perfect fundamentals. You're going to say to yourself, wow, I scrubbed this esophagectomy, or this Whipple operation I got to scrub was awesome, or this right hepatectomy, or this kidney transplant, or maybe a cabbage, or you saw something else, right? Well, those are all amazing, and you will get to learn how to do all those operations. But there are a ton of steps before those surgeons were able to do those operations, and it comes down to having perfect fundamentals. So what are perfect fundamentals? Learning how to hold the needle driver, learning how to hold the laparoscopic instruments, learning how to have proper ergonomics, okay, having your posture correct. Then there goes the tying knots, tying square knots, avoiding tying air knots, being able to sew effectively and have efficient needle control. If you can work on those things, be the one that asks the senior resident, hey, can I close that skin for you? Hey, can I close those port sites? Hey, can I X? Do whatever. But strive for perfect fundamentals and solicit feedback. Is there any way I could be doing this a little bit better? How do you look so smooth and so efficient when you tie? Just think about that. By the end of my intern year, I want to have perfect fundamentals. And then practice every day. Number 8. Now, this is not really well, it is. It's a recommendation, but it's also a statement. And the statement is team. You are on a team, and you might feel like you are the lowest, least important member of that team, but that's not at all true. You are an integral part of your team, and that team is responsible for patient care, and that team is huge. It's not only your resident team, it's the doctors, including the attending surgeon. It's the nurses, It's the physical therapist. It's the occupational therapist. It's everybody that has a contact with that patient. And you have to be an important member of that team. And so that means not throwing other team members under the bus. That goes especially for senior residents. It never looks good when you're throwing the junior residents under the bus. For the interns, it never looks good if you're throwing the medical students under the bus. Okay, so important member of the team, and remember that if the team does well, everybody does well, the patient does well, everybody's pumped. So we're up to number 9, and I think this one is so incredibly important to remember, and that is you are the patient's doctor. You're not just the intern, you're not just the resident, you are that patient's doctor, okay? And so it's okay to worry about that patient, to go and check on that patient, to make sure that an order is carried out, to make sure that a test was completed. If you're worried about them post-operatively, it's okay to make that phone call, especially go to the bedside. Make sure that everything is okay and lean in to the patients because they are also your greatest source of education, all right? Graduating from being that medical student to being that doctor is gaining a great appreciation for the responsibility of somebody's care, all right? So remember, you're that patient's doctor and you're not just anything. All right, let's get on to number 10. Now, number 10 is important. I got to tell you what it is, okay? So number 10 is be sunshine. Be the glass is half full person. Be optimistic, all right? Because you chose to be here and it's hard. I know it's going to be hard, all right? You know that it's going to be hard. You know, I think you know, you must have done sub-Is. You know what you're getting yourself into. And so I remember people used to ask me, how you doing? I'm living the dream. That would be my response. Never better. Now, was that always the truth? No, but if I said that, a lot of the times I just would convince myself that that must be the truth. I am living the dream. This is really what I want to do. All right. And if you go back to number 1 and you're taking care of your physical, your mental, and your emotional health, it makes number 10, being optimistic, being a ray of sunshine, a lot easier. So those are my top 10 pieces of advice. You got to take care of your physical, your mental, emotional health. All right. And then from 2 on to 10, being optimistic, you got it. If you have any questions, leave them in the comments below. I wonder if you are not an intern and you've been through this before, what are your top 10? If you're a medical student and you're worried about internship year or what the residency years have in plan, what are your biggest fears? So leave that in the comment section. I love engaging with you guys. As always, if you like this video, give it a like, give it a share, subscribe to the channel, turn on the notification bell, then you know when all these videos are coming out and you can get first dibs. You can also check out CITIZENSURGEON.com. I usually take each of these videos and then I'll put together kind of a full web page with some cheat notes on the highlights from each of these videos. And so a lot of people have told me that that has been helpful as well. As always, stay safe, study hard. I'll see you next time.